Okay. Good afternoon, everyone. We are from Group 4 and we will present on Klinefelter syndrome. My name is Sofia Nadira. Our presentation is divided into 6 parts and we'll begin with Azwa. She will introduce us to our topic, which is Klinefelter syndrome. And then Afifuddin will talk about the causes and the inheritance rate of this syndrome, if any. It will be followed by Alif, who will then tell us about the mutation that relates to this syndrome. Later on, I will explain on the incidence rate of this syndrome. Shafika will describe the symptoms. And lastly, Hafiza will then share with us the diagnosis and therapy available for this syndrome. Now, I'll pass this presentation to Azwa.
Okay, I'll start with the introduction. But before that, let me share about the history of Klinefelter syndrome. So in 1942, an American physician named Dr. Harry Klinefelter and his co-workers are the first to describe the combination of features and set of symptoms in 9 men that has come to be recognized as Klinefelter syndrome nowadays. But the etiology was thought to be due to an endocrine disorder of unknown cause until by the late 1950s, researchers discovered that men with this group of symptom had an extra sex chromosome, XXY, instead of the usual male arrangement, which is XY. So what is actually Klinefelter syndrome? Today, the term Klinefelter syndrome is referred to a genetic condition that results when a boy or man is born with an extra copy of the X chromosome. This interferes with the development of small and poorly functioning testicles, which can lead to less testosterone produced compared to a normal male, and unfortunately, it can affect other physical and intellectual development too. And for the description of the disease, as I said earlier, Klinefelter syndrome is a condition in males who have XXY X chromosome rather than the usual XY, and XXY is one of the most common chromosomal abnormalities. I will pass to the next presenter.
Okay, thank you Azwa for the description of the disease. Okay, for the causes, basically, Klinefelter syndrome does not have any inheritance rate as it occurs randomly. There is no internal factors occurs randomly by chance. Maternal age is the only known risk factor. Women at 40 years have a 4 times higher risk of a child with a Klinefelter syndrome than women aged 24 years. This is because women's chances of giving birth to a child with Klinefelter syndrome increase with age, because older eggs have a greater risk of improper chromosome division. According to the Fleischmann, all genetic abnormalities increase as the eggs getting older. That is why, as women age, the risk of delivering baby with a Klinefelter syndrome increase. We'll pass to the next presenter.
Okay, thank you, Afifuddin. So I will talk about the mutation related to this Klinefelter syndrome. So this syndrome is because of the extra chromosome is retained because of an event called a non-disjunction event. So basically, a non-disjunction event is where the homologous chromosome and sister chromatic failed to separate during cell division. In Klinefelter syndrome, the non-disjunction event can occur in 3 situations, where the first one is the paternal meiosis 1, the next is maternal meiosis 1, and also the last one is the maternal meiosis 2. So the non-disjunction event can lead to a production of a cell that has no chromosome at all, and a cell that has 2 chromosomes in one cell. So let's go one by one. So the first one is the paternal non-disjunction in meiosis 1. So the chromosome failed to separate during meiosis 1, as we can see in the picture, that one cell has no chromosome and one cell has both X and Y chromosome. So further development of the sperm cell producing the X and Y, producing a sperm cell that contain X and Y chromosome, will fertilize with a normal eggs and producing a zygote that has an extra X chromosome. So next, we will go to the maternal non-disjunction in meiosis 1. So the chromosome also failed to separate during meiosis 1, producing one cell that contained no chromosome at all and one chromosome containing two X chromosome. Thus, the developed egg cell will fertilize with the normal sperm cell and producing a zygote which contain extra X chromosome. And then the last one is maternal non-disjunction in meiosis 2. So the non-disjunction occur during meiosis 2, producing a cell that contain no chromosome at all and one cell containing two X chromosome. So when fertilization occur with a normal sperm cell, it will produce the extra X chromosome zygote, which is related to the Klinefelter syndrome. So that's all from me. I will pass to the next presenter.
Thank you, Alif. The inheritance rate of Klinefelter syndrome is 1 male to every 500 to 1,000 males. That is an approximate of 0.1% to 0.25%. However, this is based on the data from the United States. In Malaysia, the latest research that I was able to find was in 2016 with only 7 recorded literature based on a research made by Nur Shafina and others. The sad part is that only 25 to 50% of patients with Klinefelter syndrome are diagnosed during their lifetime. So that's all from me. I'll pass this presentation to Shafika.
Thank you, Sophia. So let's talk about the symptoms and signs of Klinefelter syndrome. For your information, symptoms of Klinefelter syndrome are not always obvious, and most of them are not able to diagnose the symptoms until they seek for the medical help because the infertility, the loss of sex drive, and also bone fracture. So for the babies, the first symptom is quiet than usual and slow learner. It means like they take longer time to sit up, crawl, walk, and also speak. And the testicles that haven't dropped into the scrotum means that this is the penis, and behind of that is the testicles in a pouch of skin called the scrotum, means that testicle then haven't dropped into the scrotum. And also they have the weak muscles. For the children, they have low levels of energy, difficulties learning to read, write, and do math, and shyness and lack of self-assurance. This means like the lack of self-confidence and trouble and problem in the development of social skills and language skills. Next one is for teenagers. Breasts that they are larger than normal, which is known as gynecomastia. Gynecomastia is the enlargement of or swelling of breast tissue that occur in a male, which caused by a higher level of estrogens and also out of balance with testosterone levels. So our next one is less facial and body hair, and it grows later. And also they has longer arms and legs, broader shoulders, and wider hips. And puberty does not occur, may occur later, or may not occur at all because the testicles does not release the specific hormone. And also they have small testicles. As you can see on the picture, the green one is the testicles that occur on Klinefelter syndrome, but the black one is the normal testicles for a normal male. And lastly, for adults, the symptoms is sterile, low levels of testosterone because the lack of testicle, they have small testicle, that's why they does not release a lot of testosterone. Low sex drive means they do not have desire to having a sex, and also large breast than normal. So I will pass to Hafiza.
All right, thank you, Shafika. I will talk about the diagnosis and also the treatment regarding to Klinefelter syndrome. So there are two main tests in order to diagnose Klinefelter syndrome, which is the first one is hormone testing and the second one is chromosome analysis. For hormone testing, the blood and urine samples of the patient will reveal the abnormal hormone level. As we know, Patients with Klinefelter syndrome tend to have lower level of testosterone compared to normal men, and they have higher level of gonadotrophin, which is luteinizing hormone and follicle stimulating hormone compared to normal men. Thus, if the patient has this low level of testosterone and higher level of gonadotrophin, the patient is suspected to have Klinefelter syndrome. And then the second test is chromosome analysis, where it can be also called as karyotype analysis, where this test is used to confirm a diagnosis of Klinefelter syndrome. The blood sample of the patient will be sent to the lab in order to check the shape and the number of chromosomes. If the patient has an extra X chromosome in the sex chromosome, the patient is confirmedly diagnosed as Klinefelter syndrome. All right, is there any treatment regarding to Klinefelter syndrome? Sadly, there is no cure in order to completely treat this syndrome, but we can treat some of the symptoms. For example, the first one is testosterone replacement therapy for development of male figure, where testosterone will be injected into the muscle of the patient, and the patient will have high level of testosterone and has higher male figure compared to patients who do not undergo this therapy. And secondly, in order to help build muscle and increase the strength like normal men, this patient can undergo physiotherapy or they can go to the gym. And then thirdly, as we all know, one of the significant features that Klinefelter syndrome has is that they have larger breasts compared to normal men. Thus, in order to remove this excess breast tissue, they can undergo breast reduction surgery. And lastly, boys with Klinefelter syndrome may also have problems with attention, speech development, and also learning word skills like spelling, reading, and writing. Thus, this patient can undergo speech and language therapy during childhood in order to help with speech development. All right, then I will pass to Sophia for conclusion.
In a nutshell, we have described the genetic origin of Klinefelter syndrome as well as the causes, the mutation related to the syndrome, and the symptoms of the syndrome. While no cure is known, a number of treatments such as physical therapy, speech and language therapy, and counseling and adjustment of teaching methods like what Hafiza have just presented earlier may help men who have this syndrome. That's all from us. Thank you.